5 years, more than 40% of the VA workforce will be able to retire.
But the School of Nursing at the University of Minnesota is ready to combat that loss using funding from the VA, especially training students to understand veterans' complex medical demands. And here to tell us more is Brad Foley, RN and an adjunct clinical instructor for the VA Nurse Academic Partnership. Good morning, Brad. Thanks for being with us.
Thanks for having me on this beautiful Memorial Day.
Well, with the VA being plagued with so many problems, it's nice to hear something like this is being set up. How does the program work, Brad?
Well, basically, we have received funding for 5 years in order to increase the enrollment through the University of Minnesota Nursing School. And we are training 20 extra students a year in veterans care and specializing in veterans health concerns, so that we may have those people not only in the VA but out in the community addressing the concerns of veterans as they encounter the healthcare system.
And so this program's got $5.3 million in funding from the VA. This is the first ever graduating class this May. 20 students per class. 5 of the 20 have taken positions at the VA. And you mentioned the specific health concerns for veterans. We hear a lot about PTSD, Brad. What are the other big concerns, big health problems that these graduates are being trained to look for?
Well, we've really tried to broaden the experience of our graduates so that they address. They have done some work in the homeless programs at the VA, some in mental health clinics, as well as addressing some of the the physical concerns and the concerns of exposures, for example, based on the era of when the veterans served. So, for example, everyone is quite commonly known that Agent Orange is a concern of Vietnam veterans and Korean veterans.
Well, kudos to the program for tending to our troops for sure. But it appears, it seems like it's a no-duh moment that other healthcare workers should be trained exactly the same. I mean, how much longer will it really take to learn some of these skills?
You're absolutely right, and one of the goals is of this program, beyond simply training nurses and educating nurses to care for veterans, is interprofessional care, to bring this to all the clinicians that are out there serving veterans, both at the VA and in the community, and to really try to make sure that wherever a veteran seeks care, that care is appropriate and really takes advantage of the resources that veterans have in the community and in the entire country.
All right. Thank you, Brad Foley, for coming on and for taking care of our brave servicemen and women when they come home.
Thanks very much.